Drooping eyelids and lower eyelid crepey skin are aging skin conditions that tend to be a challenge to treat, especially at home. If you want to learn about an in-office treatment that is non-surgical, that will dramatically improve your eyelids, lift them, tighten them, give you a mobile eyelid again, then this is the video for you. Let me introduce you to Tixel. I'll share all the details of this treatment, the actual treatment, the healing time. I will share with you, of course, the results on a real life person. So let's get into it. First of all, what is Tixel? Tixel uses thermomechanical ablative technology. It works by direct use of heat to tighten the skin. Tixel is not a laser. It's not a light. It is actually a titanium plate with little pyramids on it that when applied to the skin in quick little, like fraction of a second, little shots quickly on the skin, it delivers this heat into the epidermis and then into about the dermal epidermal junction. It causes a coagulation of the skin in little tiny crusty pieces. Those will flake off. It also encourages, overall glow. It can help with hyperpigmentation. It can help with acne. It can help with acne scarring. It can help with overall textural improvements. And of course, it definitely does stimulate collagen. There are 3 power levels of Tixel. So there's 3 options when you go to get a Tixel. There is something called Tixel Glow, which is very surface. It is very low downtime. It requires many more treatments over a long period of time in order to get the results of some of the more intense Tixel treatments. That's called Tixel Glow. Then we have Tixel Intense and Tixel Super Intense. Now, what's important about the difference between the Glow version and these 2 more intense versions is that they are ablative. This little plate, this little titanium plate, heats up to 400 degrees and it is pressed into the skin really, really quickly and delivers that heat into the skin. The skin is then coagulated in this little grid that I will show you, and essentially it will improve the surface, the epidermal resurfacing, and then also do that collagen generation. Now, in the intense and the super intense, there is ablation, meaning the skin is broken through. The heat causes all of those changes that we want, but also causes us to have more downtime. Obviously, the intensity of the treatment is closely related to the downtime and just how you're going to look, the recovery, all of that stuff. Now, speaking of downtime, I think it is really, really important to note that downtime is relative. It's really important to have a very frank conversation with your practitioner about what downtime means to them and what they have seen. Because for me, downtime might be social downtime. So in 3 days, I can put some makeup on, I can go out, I'm presentable, but I probably wouldn't want to be going to a party. So that might be downtime to me. Downtime to someone else might mean I want to be all the way back to where nobody knows I ever even did a treatment. That's a different version of downtime. A lot of the manufacturers of these various lasers, I found it over and over and over, their version of downtime is not the same as what ours might be, and we all would consider ourselves still down at the end of their predicted downtime schedule. So it's always good to have a buffer. Now, when I went along with my colleague and friend, Nancy, to see Joe, and I am going to link all of Joe's information down below where she performs treatments and everything, so that if you are in England, she is absolutely amazing and definitely worth contacting for this treatment. And she does obviously other treatments as well, but she is an expert in Tixel, and I feel like you'd be in fantastic hands. Now, when we talked to Joe about downtime, she did also recommend that you give yourself a full 2 weeks before you have any important social engagements. And I think that that was a really, really good advice. This was Nancy's 4th Tixel treatment, and it was actually her maintenance treatment. So we have a full year of Tixel treatments on Nancy to show her progression of her before for her eyelid and all the way to post her 3rd treatment. And then for this 4th treatment, I went and collected a little bit of her recovery process. And of course, course, I collected the actual procedure in progress. Nancy had her treatment, and it did take about probably 20 minutes. The entire treatment in general will take 30, let's say 20 to 90 minutes. This really does depend on the type of treatment that you're getting. The treatment can be tailored to be very, very gentle with low downtime, and you have to do multiple treatments, to a little bit more intense, a little bit more intense, and then the most intense. And it depends on the amount of time that that heat is introduced into the skin. So the fraction of a second, and then if it's a little longer of a second, a fraction of a second, etc. The exposure time to the heat, as well as how many passes the practitioner does over the skin. Nancy had 2 passes over the skin. Now, Joe did adjust the settings just a little bit, completely bespoke for Nancy's eyes, because this was her 4th treatment. So your practitioner is able to tailor the treatment exactly to what she or he thinks that you will need. You're gonna look at a recovery time for Nancy. This is her day 1. That would be the day of treatment right after. We decided that we would do something called a cringe scale. And on a scale of 1 to 5 cringe, 5 being you would feel uber cringe to go out in public and have anyone see you. On day 1, Nancy self-assessed herself at 3 cringe. So out of 5, she was like, I'm red, I feel very hot, very sunburned, but the swelling hadn't started really yet. It was very, very subtle. And in fact, she even said she liked a little bit of the under eye swelling, because it was almost like, she had a little bit of that plumpness back. Naturally, that's going to go away. It was just a little bit of edema, a little bit of swelling, a little inflammation. Okay, now on day 2, you can see that Nancy is inflamed. And what is really, really important to know is everything looks much worse while you're recovering from almost any treatment than it did even before, right before you started, and definitely before what you will ultimately find to be your results. That's super important, because it's easy to all of a sudden be like, oh no, because you don't look good. So just be prepared to not look great for a few days at least. Now, on that day, we assessed her at a cringe level of 5, meaning she didn't really want to go out and see people. She was swollen, she was still red and blotchy, and she just really did not feel fantastic on that second day, so the day after treatment. On day 3, she actually started to feel a little bit better, was still a little bit swollen and still just a little bit blotchy, a little bit of redness, but she said that her cringe level had gone down to a 4. So it was definitely on its way back down. Now, by day 4, she said that her cringe level is back to a 2, and she feels like she could put on makeup, she could go out. She would not want to be in some kind of a social engagement like a wedding or a party or something like that, or an important meeting, but definitely was able to be socially interactive with makeup on and not feel like she looked horrible. By day 5 for Nancy, she felt like she was fine. She wasn't back to base level, but it was pretty negligible as far as how she felt at that point. Now, I want to share with you her results, because I think that they're pretty incredible. Nancy started out with, she had some hooding in her eyes, some laxity. She was 56 years old when she started the treatments. She'd done several things to try and improve her eyelid skin. She had tried using various devices, various topicals, etc. Gotten some results in the past, had some, some improvements, and, kind of doing this as she's aged. But most of the things that she had done to, any area, no surgeries or anything like that, were far enough in the past, plus she was older. So everything that you see in these before and afters, this is the only thing that was newly introduced. So we can definitely say that in this period of time, it is Tixel and Tixel alone that would have affected the improvement in this area. Okay, let's look at these results of Nancy's. I wanted to go through kind of a progression. You can see her before pictures, and then you can see that after her first treatment, she really didn't feel like she had any significant results yet. Then she had her second treatment. And it wasn't until about a couple weeks after her second treatment that she actually notated that she was starting to see a lift in her eyelids. And the thing is, and I really want to stress this, we actually weren't planning to put this on YouTube. She was taking these pictures for herself. And so, yeah, it's variable lighting, it's variable circumstances. She was just popping pictures along the way over months and months and months. But I think that there's no denying that you can see over time that there was a lift in the eyelids and that you can see more of the mobile lid. And she sees a massive improvement in her eyelid. So much so that she said, I can wear eyeshadow again. I mean, she is 100% putting off any kind of blepharoplasty because of having Tixel. Now, everybody's gonna wanna know about the cost. I know that, and it is a range. So it really depends on if you do a full face. Do you do your neck? Do you just do your eyes? It depends on if you get the glow, if you get the intense, all of that stuff. So I would say that you can gauge, depending on where you live, that a Tixel treatment might run anywhere from $300 a treatment, depending on how much you do, all the way to, let's say, $700 a treatment. And it sounds like 3 initial treatments will get you some results. I also did come across during studying this that everybody said it's a course of treatments. So if you think you can only afford one single Tixel, I probably would not recommend, because you're not going to see the results that you want after just one. It is a series of treatments that are required in order to see the results that you want. And that's what Nancy found as well, because after that second treatment, a few weeks after, is when she started to see the results, and then they built on themselves. Then she got that third treatment, and it was a few weeks after that that she really was like, wow. And that is the actual before and after that I will show you in conclusion of Nancy's results, are her before any of the Tixel treatments at all at 56 years old, and then her after her third treatment. That is her first initial after her first course of treatments of 3, and she was incredibly happy. And also, of course, we have to remember that we're aging, so usually things are going the other direction. I am just incredibly impressed with this, and I think that this is the first time that I have seen an in-office treatment that is not surgery that truly makes a visual difference in eyelid skin. And the fact that it's relatively low downtime and that it is relatively affordable compared to blepharoplasty is pretty incredible. Now let's look at some of the before and afters on PubMed, because I do think that they show exactly what Nancy's results showed. You can see the before, and then you can see the after, and the marked difference in the laxity of the eyelid. It's absolutely incredible. So in conclusion, I think that this is 100% an alternative to upper blepharoplasty. This treatment isn't just for your eyes, though. It is something that is used for acne scarring. It is used for hyperpigmentation. It is used for texture. This is good for all ages. So if you are 30 years old, this would be fantastic. You could be a good candidate for this. But also if you are 60, 70, 80 years old, if you're noticing laxity, jowls, eyelids, neck laxity, anything like that, just look into Tixel. Check it out. See if you have a provider in your area. Get a consultation and discuss with them your specific concerns, because from what I have seen so far, I think that this is a very, very exciting treatment for tightening the skin, for working on areas that prior to were incredibly hard to treat at home and were only really truly addressed with a surgery like upper blepharoplasty. So I think that this is an excellent option, and I really wanted to share this information with you because in my community, this is one of those things that comes up all the time, and people are always looking for ways to improve their eye area without having surgery. And this is a great thing to investigate. I hope that you enjoyed this video. If you have any questions, certainly leave them down below. I will do my best to answer them. And I hope you have a really fantastic day, and I'll talk to you in my next skincare video. Take care.